My name is Katrina Randolph. I'm the owner of Church Shades Hair Studio. I'm a beautician and a certified community health worker through the state of Maryland, and I'm also part of the Health Advocate and Search and Research team.
All right.
Good afternoon. I'm Denise Richmond. I'm the president of Luminis Health, Doctors Community Medical Center, and just so glad to be out here. And you know what? We think people have to be professionals to call themselves healthcare workers. These are healthcare workers.
Yeah.
So you heard them say they are certified community health workers. I was listening. I heard that. And this is how we are going to get our community healthy, is by partnerships with Dr. Thomas and partnerships with people who are in the community and serving as trusted voices. So thank you so much.
Thank you.
So the initiative that we have here in our barbershops is called Hair Health Advocates in Reach and Research. Our barber stylists have been trained and now they are certified by the state of Maryland. And President Richmond, we're here in Hyattsville.
Yes.
One of the hot spots for COVID infection and one of the low vaccination rates in the state, in the county. And so we decided to come where people already have trust and to work with people who are already trustworthy.
Yes.
And so, Katrina, I know there were some people here because of your encouragement. Can you say just a little bit about what you think it took to motivate them to be here today?
Well, I just always give them the simple system. I said, okay, if 500,000 people died of the virus, and 2 million people has gotten vaccinated, only a few of them has passed away. Which one do you want to do? Your life is on the line. Which one would you choose? And they chose to come get vaccinated today.
So you like to give them choices.
Yes.
And Mike Brown, what's your strategy?
Well, I tell them that if plan A is to get the vaccine to stop the spread of the coronavirus, what's your plan B if you're not going to take the vaccine? And that's what we have to talk about it right there. Most of them don't have an answer. So they try to go into about, what about the cancer shot? What about cancer been around for? No, we're talking about the coronavirus. You want to get the shot? So that's what we do.
And have you seen people come around after you spend time with them?
Absolutely. Talk to the wall for a minute, but eventually the wall breaks down and you get through. So I was happy to see some people come out this morning after taking the position to say no. See a few that came. We still got work to do. It's not over. So this is just the first one. We still got work to do.
And part of that work is this is the first one that we've done in a barbershop in the state of Maryland. We were talking about churches, people get it. In fact, Luminis has been at many of the major churches. And now we're coming right down into, you call this the grassroots outreach. And you know, President Richmond, this community also has the type 2 diabetes and the heart disease and the other chronic conditions that make COVID so dangerous for our communities. Do you think that we can take advantage of what we've done here today around COVID and stay engaged with these populations?
Absolutely. As I mentioned, this is about creating health in our communities. And the reason why, and I love when you gave your stats.
Thank you.
That was wonderful. She just right there had the stats right there. And so then we have to say, well, why is this happening in our communities? Well, it's happening in our communities, Dr. Thomas, because exactly what you said. We have higher incidences of underlying health conditions. You hear people talk about comorbidities. Well, what we mean by that is people have other health conditions that make them more likely to suffer when if they were to get COVID. And some of those are the same people who are the last ones to get in line. But thank you to our advocates here for helping to educate and get people out and to understand. And it doesn't stop with COVID. So while they are here and in subsequent, interactions, we need to continue talking to them about their diabetes. We need to continue talking about high blood pressure. We need to continue talking about preventive health, including mental health, because that's another big issue that we don't like to always talk about in our community, and particularly during this pandemic. We know that the incidence of people having stress and anxiety and depression just from everything that they've been going through for the last 15 months is huge. So we need support networks to address keeping them healthy with the COVID vaccine so that they aren't getting COVID, but then that's step one. And then we need to continue to focus on all of their health. Health, mental health, physical health, spiritual health, everything, because it all matters.
And so here we are, and we're going to work on our language, because President Richmond, when I would come out here and talk about herd immunity,
Oh, no.
the community, the barber said, Dr. T, that doesn't work here. And I was doing that kind of talk during Black History Month. And you know, you got the Underground Railroad on the movie streaming now. So here's what they said we should do. Turn around, Katrina.
I saw
Turn around,
it.
Mike.
Community.
Community,
All right.
community. That's what this
I
is
love
about. Community, immunity.